Do you get pain on the outside of your hip when you're climbing stairs? If you get hip pain when you're going upstairs, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what causes hip pain when you're climbing stairs, as well as some simple tips that you can use to go upstairs without having hip pain. Now, if you find this video helpful, give it a like and subscribe to our channel. We help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So what are the things that cause hip pain when you're going up and down stairs? Well, a lot of people think that they may have hip arthritis, but most people feel hip pain on the outside of their hip. And hip arthritis pain actually is more often in the groin. Your hip joint is actually kind of right in this area right here, this bump on the outside of your hip. It's not the true hip joint. It's a little bump called the greater trochanter. And there's a bunch of things that run over the outside of that trochanter. There's your hip muscles, your gluteus medius and your gluteus minimus, and the tendons of those muscles run over the greater trochanter. There's a little bursa underneath of that, and a lot of people hear of hip bursitis or trochanteric bursitis on the outside of their hip, and that's what often gets blamed for hip pain when you're climbing stairs. Additionally, there's your IT band. It's a long tendon or band of fascia that runs over top of that bursa. And all of those things can cause hip pain when you're going up and down stairs. Now, it truly doesn't matter that much which one of those structures it is, because the mechanism, the thing that causes all of those issues, is the same thing. And that is weakness of your hip muscles. That if your hip muscles, particularly those gluteus medius and gluteus minimus muscles that I mentioned before, if you can't stand on one leg like this and balance your pelvis, then your hip kind of drops out to the side like that. And that pushes the hip bone or the greater trochanter outwards into all those structures on the outside of the hip, the IT band, the bursa, the tendons of the gluteus medius and gluteus minimus. And that can cause tendonitis, bursitis, or IT band syndrome on your hip when you're climbing stairs. So how do you prevent that from happening? Well, if the cause is weakness of the hip muscles that makes you go out to the side that way, it would make sense to strengthen your hip muscles. Now, one of the best ways to do that is just to stand on one leg. If you can't stand on one leg, climbing stairs is going to be really, really difficult. Now, you should do balance exercises, and ideally, it's best if you can get to where you can stand on one leg. Don't practice this on stairs. I'm just doing it for the sake of the video, but practice standing on one leg on the ground and get good at balancing on one leg, because it puts even more effort on your hip muscles when you start climbing stairs. So if you can't do this and balance and keep your pelvis level without it kind of dropping out to the side like that, without your hip falling down that way, then that's the first place to start. Now, after you've kind of gotten that down pretty well, the next step is to work on keeping your pelvis level as you're going up and down stairs. So as you push up the stair, that requires a little bit more effort out of your hip muscles. You use your gluteus maximus, your butt muscle basically, to help you drive up the stairs. Additionally, you use your quadricep muscles to help you drive up the stairs. And while you're doing those things, you use the gluteus medius and the gluteus minimus muscles to help keep your pelvis from drifting out to the side. So when you're going up and down stairs, if you put your foot up on the stair and then think about just pushing your knee outward a little bit. When you push your knee outward, that activates your gluteus medius and your gluteus minimus, their hip abductor muscles, which means push the hip out to the side that way. And if you focus on doing that as you're climbing stairs, it keeps your knee from drifting inwards that way and stretching those structures over the outside of the hip. So that's one easy tip to help you climb stairs more comfortably. Now, the other thing, and most people do this intuitively, is to use a rail. And that's smart just for the sake of safety and balance anyway. But when you use a rail on the opposite side of the sore hip, it makes it a little bit easier to balance. That if you're standing on one leg, gravity is naturally going to tip you over that way. So if you have something to hold on here to kind of counterbalance and push you the other way, it helps neutralize that force of gravity, which has a tendency to make you drop down that way. Now, what if you only have a rail on one side? Well, if this is your sore hip over here and the rail's over here, and you don't have a handrail over here, you're going that way. So using the rail doesn't necessarily help you quite as much. I'd still use it for balance purposes if that's all you have, but it's not going to help you really as much with the strength of the hip. You may even feel like if you have a sore hip on the side that your banister's on, you have to kind of pull yourself up the stairs with your arms. And that's obviously not a great situation. Or you may find yourself just going up one step at a time like a little kid does when they're first learning to climb stairs. And if your hip hurts really bad, going up with the goods, so to speak, and just doing that one step at a time is a good short-term workaround, but most people don't want to be limited to doing that for the rest of their life. So that's good if you need to give your hip a rest and prevent it from getting further flared up, but over time you do eventually want to get your hip muscles stronger so that you can go up and down stairs a little bit more easily. Now, if your sore hip is on the same side as your rail at home and you don't have rails on both sides, using a cane in one hand can be helpful to kind of help you balance and go up and down stairs, or just going up one step at a time for a short period of time. Now, if you can't go up and down stairs and you try pushing the knee out to the side and that's not even cutting it, you can do some strengthening exercises at the bottom of the stair, and using the bottom step on the stair, stand sideways on it and keep your weight on your heel and just do little mini step downs like that. My foot's not getting all the way down to the floor. It's not the full height of the step. So it's a little bit easier than going up the full step if you're just doing that little partial mini step up. And as you get stronger, you'll find yourself able to go down farther and farther and farther until you get the full step height. And that'll help you when you go upstairs to have more strength in your hips. You can climb more comfortably and you're not stretching all those structures, your IT band, your hip bursa, and the gluteus medius and minimus tendons over the outside of the hip. Now, other things that you can do if you have pain on the outside of your hip when you're climbing stairs are getting physical therapy. And particularly there's some physical therapy treatments that work really well for outside of the hip pain. I've had several instances where people have a trigger point or a knot in their gluteus medius or gluteus minimus muscle, or sometimes their piriformis, which is a muscle out there. And those sometimes are the causes of pain on the outside of the hip. And dry needling those muscles sometimes gives relief in as little as one session. Not always, I can't promise that 100% of the time, but there are many times where it makes a significant or sometimes complete improvement in a single session. So if that is something that you find yourself interested in and you happen to be in the St. Louis area, we'd be happy to help you out with that at More for Life. And if you found this video helpful and some of these tips help you to climb stairs a little bit more comfortably, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.